Hi everyone, this is Venjet from PBL 11. Today we will be going through case 3. So this will be the description of our case. It mainly involves Mr. C. So here are the important cues for our case. So this is Mr. C, a 60-year-old gentleman who is a known type 2 diabetic for the past 10 years. He has no allergies and has been treating himself with metformin from different pharmacies. He was prompted by his pharmacist to perform a blood test, and the results were shown to indicate that Mr. C has renal impairment. So this is the blood results of Mr. C. As we can see from the results, his creatinine level is at 350 micromoles per liter, which is markedly elevated compared to the normal range. For his HbA1c, it is expected to be elevated compared to a normal range, as he is known type 2 diabetic. However, with his metformin, we should expect his HbA1c levels to be well controlled, to be more controlled, which will be aiming for HbA1c of less than 7%. His hemoglobin level is, however, unusually low. So we will discuss this results in the next of our slides. Our choice of anti-diabetic agent would be glipizide, which is a short-acting sulfonylurea. We'll discuss our justifications from two aspects: why we should discontinue metformin and why we should start Mr. C on glipizide. So this is mainly due to the excretion and metabolism of glipizide. But before that, glipizide is normally used as a first-line agent for non-dialysis chronic kidney disease patients with type 2 diabetes. The excretion of glipizide would be suitable for Mr. C because glipizide is mainly metabolized in the liver. However, it is excreted as inactive metabolites in the urine. Therefore, those adjustments for Mr. C, who is an elderly patient with renal impairment, is not required, as the metabolites are inactive and would not affect the body if accumulated due to a low GFR. Sulfonylurea monotherapy has also shown to be effective in lowering HbA1c levels by 1.54%. On the other hand, the reasons why we should discontinue metformin is because of the adverse effects brought upon by metformin. Metformin, if taken long-term, can cause vitamin B12 malabsorption, which will explain the anemia which is being experienced by Mr. C. On the other hand, metformin also causes lactic acidosis, especially in patients with renal impairment. Other important issues that need to be addressed with Mr. C would include his hyperglycemia as well as complications of diabetes, such as his renal impairment.
Hello, hi, I am Shukri, Banjat's PBL Med, and I will continue the discussion for question 3 in this case. So other important issues that also need to be addressed with Mr. C include screening and managing other possible complications that are associated with diabetes. The long-term complications can be divided into two major types, microvascular and macrovascular. For microvascular, possible complications include neuropathy, retinopathy, and nephropathy, while for macrovascular complications, example are peripheral vascular disease, ischemic heart disease, and cerebrovascular disease. It is also important to screen and manage other metabolic disorders such as dyslipidemia, hypertension, and obesity. This is really crucial to further reduce the risk of developing associated complications as well as improving the quality of life of Mr. C. Not to forget, lifestyle changes are also needed to make sure Mr. C has a very good glycemic control. For that, we should advise and encourage Mr. C to have proper diet as well as emphasizing on physical activities or exercise. It is also important to educate the patient in regard to diabetes. For example, education on hypo and hyperglycemia and the way to manage it, education on self-monitoring blood glucose for appropriate dose adjustment, and also education on the potential complication as well as education on how to have a proper lifestyle. Last but not least, we should make sure that Mr. C has a very good support. This is crucial to ensure that Mr. C will always adhere to his treatment and management. Example in what we can do includes providing family education, providing helpful resources on knowledge about diabetes, and suggesting carriers such as the Paul Fox home if he is really in need to. So that's conclude our presentation. Thank you.
Hi everyone, this is Venjet from PBL 11.